founder of Life 365, and welcome to Season 3, Episode 8 of The New Normal. On today's episode, we'll be discussing the innovative solutions and services available to drive success as we move towards value-based care. I want to take a minute to thank our panelists for joining us today and sharing their valuable time. I would also like to thank our attendees for your interest in the new normal. As for the structure of this webinar, attendees will be on mute and we'll have reserved time for questions. Please place your questions within the Q&A. You can review the recordings on today's webinar on www.newnormal.buzz. Just for a quick introduction, the move towards value-based care, the move towards value-based care, where providers are paid for the quality of care outcomes instead of quality of care under fee-for-service, has shifted balance of risk. This shift better aligns payer, provider, and patient goals towards better outcomes and managing cost of care. Today, we're going to discuss the services, products, and tools available to drive success as we move towards value-based care. Our panelists will share their insights on strategy for success and the power of leveraging data to help make these new models feasible. Now I want to introduce our distinguished panelists. Dr. David Rhew is Global Chief Medical Officer, CMO, and Vice President of Healthcare at Microsoft. Dr. Rhew is adjunct professor at Stanford University, holds 6 US technology patents that enable authoring, mapping, and integration of clinical decision support into electronic health records, and has been recognized as one of the 50 most influential persons in healthcare by Modern Healthcare. Dr. Rhew received his Bachelor of Science degree in Computer Science and Cellular Molecular Biology from University of Michigan. He received his MD degree from Northwestern University and completed internal medicine residency at Cedars-Sinai Medical Center. He completed fellowship in health services research at Cedars-Sinai and infectious disease at the University of California, Los Angeles. He served as CMO and Vice President of Samsung, Senior Vice President and CMO at Zinc Health Incorporated, clinical researcher at the VA Greater Los Angeles Healthcare System and RAND, and Associate Clinical Professor at Medicine at UCLA. Welcome, Dr. Rhew.
Thank you, Kent.
Thanks. Lee Shapiro, Managing Partner at 7Wire Venture. Lee has spent the last 30 plus years focusing on building sustainable companies. He served as an officer of Allscripts Healthcare Solutions, Inc. for 12 plus years, executing over $4 billion in mergers and acquisition. His role included developing strategy, building international operations, business development and partnerships, government relations, health plan initiatives, and business activities in the areas of analytic and information services. Lee is now managing partner at 7Wire Ventures, who invest in early and growth stage companies and leverage their experience and network to maximize value. 7Wire Ventures spurs on ideas that make a positive difference in people's lives, leveraging experience to build the next wave of great companies. To provide a little context, I'm going to ask the panelists to briefly share some information about their roles and their organization. So Lee, do you want to start off quickly with 7Wire Ventures and Transcarent and about your background?
Sure. Ken, thanks so much for inviting me on. I think I'm the abnormal part of the new normal. So be glad to be here, and especially joining David, who's been a friend for a long time. 7Wire Ventures, as you mentioned, is focused on helping to build companies that address the challenges that we all face as consumers of healthcare. We all want to be healthy. None of you listening to the webcast today would volunteer to be a patient if you could avoid it tonight at any of the great medical institutions we have in this country. And for those living with a chronic disease, now it's really, when we think about this, especially as we age, we now are living longer and experiencing more in the way of chronic disease. You want to experience your life with the things that you want to do with your families and friends, and put all that in the background. And so our hope is that by working with those who are at risk for the cost of care, we can build great companies that allow us to improve outcomes and reduce the cost of care while creating great consumer experiences. You had mentioned one of those companies that we had launched at Seven Wire. My partner, Glenn Tolman, has joined as CEO, although still has a very active role with the Seven Wires Fund. And Transcarent is helping to provide a new and better health and care experience for those who are inside of large self-insured employers by directing them to the right resources and being proactive around the ways in which they can anticipate the nature of the care that they need and directing them to the right resources to be able to take advantage of some of the great technologies that are available in the marketplace, as well as direct them to the right providers when they do need to go for in-person care. And we're fortunate to back 20 other companies in our portfolio, and we'll have a chance to talk about a few of those others today.
Yeah, great. Thanks, Lee. I really appreciate that. So, and I want to dig into more about Transcarent and also the journey with Livongo as well along the way. So, Dr. Rhew, what about your position, at Microsoft and also your journey along the way at Samsung and other companies that you've worked for?
Ken, first of all, a real pleasure to be here and great to see you, Lee. It's been a while and super excited at all the progress and exciting things that you all have done. A little bit about myself. I'm actually more of a health services researcher that has now somehow found my way into a technology world. Much of my focus when I started my career was looking at gaps in care and finding ways that we could provide the right information at the right time to inform individuals so that they could be smarter about the decisions, ways that we can make care more efficient. And what I found was that while we can do this through a manual process, it works a lot better. It's much more sustainable when you have technology that drives this. And to do that, we have now been focusing a large part on technology-enabled platforms and solutions that allow us to be able to achieve those goals. My career pivoted during the meaningful use period when everyone was starting to focus on the electronic health record. That was the vehicle for how a lot of healthcare was being delivered. And that's where I spent a lot of my time trying to understand how we could provide that decision support within those systems. But I think one of the things that I also had a passion for was, looking broadly about, you mentioned value-based care. I served on the National Quality Forum CSAC committee, where we used to endorse measures that we still do, I should say, the NQF still does, but at the time, some of these measures were pretty controversial. The 30-day readmission, 30-day mortality is a great example. Clearly at the time, there was a feeling that how can a hospital or a healthcare provider be responsible for the care that occurs 30 days out when they're not even in my institution? I mean, they could get hit by a bus. And, this whole concept of, thinking about how we could take on greater risk became something that I was very interested in trying to help address. And I realized that the missing piece, or one of the missing pieces, was consumer engagement. And so I started spending a lot of time working on digital health solutions, and I joined Samsung, was chief medical officer for 6 years there. Spent a lot of time thinking about creative ways that digital health could be used. So not just simply a person using an app or a smartphone, but building programs that were designed to improve overall outcomes and finding ways that we could ensure that those outcomes are met through adherence. And what we realized was that while in the process of building these systems, the data was siloed or locked into different systems, whether it be the EHR or your wearable. And actually, my background was in computer science, believe it or not, and my thesis was artificial intelligence in healthcare. So kind of came full circle because I was trying to figure out how to pull all that data together, and I couldn't do it within our organization and the partners that we were working with because of the lack of interoperability. And so that got me very interested in understanding how we could promote more interoperability. And at the same time, this is when I saw a lot of organizations leaning in on this. Microsoft was at the forefront, and given their desire to be able to help improve the level of interoperability, build the platforms that can help support it, and then add artificial intelligence on top of that, that was the company that I knew was the right fit for me. And I moved 3 years over to serve as the global chief medical officer at Microsoft.
No, that's great. So let's stay with that just for a second. So, I know that Microsoft has like integration or partners of like 300 plus health systems, and hospital systems that are out there around the Microsoft Cloud for healthcare side of the equation. What is the ultimate goal that you believe Microsoft Cloud for Healthcare is going to help the health systems accomplish. There's value-based care initiatives out there. There's hospital at home initiatives. What is the instrumental thing that Microsoft's going to do? I always ask the question, is Microsoft going to be an EHR one of these days from that standpoint? Or are you Switzerland that stays in the middle, right, to kind of connect everything together?
Well, I can quickly dispel that question. We will not become an EHR. I mean, our role is really as an enabler, but we do see that there are several opportunities where digital cloud-based technologies can help connect people and organizations and make things more seamless. And as we think about better outcomes and better experiences, it always ties back to how can data be brought from different sources, centralized onto a common platform, AI being applied on top of it, and then actions being taken that will ultimately be coordinated through on typical workflows, whether it be EHR or through CRM or through digital virtual. And that really was the foundational thought for how Microsoft Cloud for Healthcare would need to be re-architected. So a lot of times people think of Microsoft Cloud for Healthcare as being a sort of branding exercise, but really what it was a re-architecture of a lot of our own internal platforms to make Microsoft more interoperable so that we could then work in collaboration with our partners to make them able to do things that they couldn't perhaps have done in the past. So we partner with EHR companies, we partner with the organizations that are delivering care, the providers, the payers, the pharma life sciences, med tech, retail, across the board, the entire health system. And a big area for us has been finding areas where it isn't important that we improve the streamlining of care. So as you think about patients and consumers being engaged and directly brought into the care system, that's an opportunity through virtual care tools and opportunities to be able to leverage remote monitoring. And now let's put AI on top of it. Within the hospital and clinical workflows, are there ways that we can streamline that process? A lot of it's paper, a lot of it's manual documentation. AI can solve those problems. So let's streamline those. And so we're really trying to smooth things out, make things easier, work better, more efficiently.
One thing that I want to just jump in and add, because Microsoft has provided a strong enabling function that allows early stage companies to get off the ground more quickly. When I think about the work we had to do 20 plus years ago in building out our infrastructure for what we did at Allscripts, it was a heavy lift. And today with the Microsoft Cloud Infrastructure for Healthcare, the work that they're doing in terms of being able to provide services available to companies that live on top of that platform. So you can have literally AI as a service. All this is enabling the advancement of companies to be able to get to market more cost effectively. We like that as an investor, allows us to be able to expand the reach. So it's not just the large healthcare institutions that are leveraging this infrastructure, but many of the early stage companies that we see in our orbit are utilizing it in novel ways. And that does allow us to be able to deliver solutions that are meeting consumers where they are, because you're now able to access information in ways that allow you to be able to change your behavior based on the inputs that you're able to share using this infrastructure in this new type of ecosystem.
And the one thing I love about, I'm going to take it off from our side really quickly about being a partner with Microsoft Cloud for Healthcare, is before we would have to go health system by health system, 300 health systems, to get behind the firewall, to integrate, to put contracts in place, to do IT security audits. We do one integration to Microsoft Cloud for Healthcare, and they can now share us with all 300 health systems that are out there, right? So it now starts creating this interoperability, breaking down this interoperability and giving these health systems access to data from home economically without having to have hundreds of vendors on their doorstep, right? And trying to prioritize with their IT departments.
That's absolutely right, Ken. I think when we talk to startups, and you have to understand that the startup is spending their precious resources on building infrastructure and platforms and addressing FHIR APIs and new standards that come out and addressing security and cyber attacks. That's a lot of work, and you're spending a lot of time and resources on things that could literally be taken out of the box. And so we understand that, if we're going to have innovation become a key driver for how healthcare gets better, we're going to have to help support startups, medium-sized companies, as well as large-sized companies. So we're really interested in helping the broader ecosystem.
Yeah, if you really think about really quickly about, I don't want this to be completely a Microsoft, podcast, but I want Lee to be in there as well. But if you really think about some of the platform plays that are going on right now, if you have to go individually to a health system to try to get an integration done, IT is so busy that they're going to go through and say, we're only going to integrate the stuff that's most important to us, right? That has the biggest bang for the buck, which means a lot of the other tools that could be incredibly helpful but don't get used so much get left behind. They don't get integrated. But integrating into Microsoft Cloud for Healthcare, into Light 365 and into the platform, you can be a long tail of solutions that are out there and provide those to a health system, whether they're used top end, or whether they're used very little as well. So Lee, the question that I wanted to ask really quickly is around the term payvider is being thrown around, right? Where people are becoming payers and providers as well. They're taking responsibility for both ends of the equation. And Kaiser was always kind of the example out there that was doing that. Are you seeing that starting to be a model that's starting to emerge? I'm hearing rumors that major health systems are starting to take both ends of that equation, that they're becoming the insured side of it, but they're also becoming, the provider side of it to control cost, as you're doing with Transcarent.
Well, there's certainly been across the industry a significant move towards integration. It's hard not to see the work that United Health Group has been doing in this regard in terms of acquiring a number of medical practices around the country. And there are others that are now scaling up in similar ways on the health plan side. Humana just made a significant announcement this week in terms of work that they're doing in partnership with Welsh Carson to be building out their care delivery system and basically building bricks and mortar clinics. So you'll see more and more payers that are on the front lines of being able to deliver care directly. And likewise, larger provider groups that have insurance organizations. UPMC has done that for many years. I think this goes back to where you started, Kent, in terms of this shift from fee for service or sick care to fee for value or well care. And being able to align incentives, that's one of the critical elements that's missing in terms of being able to get the types of services that we need delivered to organizations. The Medicare Advantage framework has a number of challenges. I serve on the board of one of the great companies that's using technology in this space called Clover Health. And we're doing this because we believe that you can use technology to help guide the types of decisions that need to be made about the care of an individual at the point of care, as well as start to think about ways to deliver more care into the home and meet those consumers where they are, especially where they have challenges accessing care. And so use of these tools to align incentives in that way so that provider and insurer have similar objectives in being able to deliver great care is part of where the industry is shifting across the whole ecosystem.
Yeah, so we're both doing a lot of talking about technology as part of this, but we know that technology is not the end all be all, right? To patient care that's out there. How deep does Transcarent get into social determinants of health and kind of bundling services together that meet individual patients' needs, right?
Well, when you think about, great companies are doing important work in this space, and I put Transcarent in that category, are leveraging the information that they have available to be able to guide the right journey for an individual member, whether that's a member of a self-insured employee group or it could be for other companies. And so we'll take information about someone's demographics, where they live, what's their income level, other things that they're sharing, whether it's with an employer or sharing with us voluntarily on a permission base. We'll also take information that comes from claims data, understanding their healthcare record, sharing information that we get from that consumer that's based, again, on information that comes from their healthcare provider, and using that to craft a pathway to understand what are their needs going to be and how can we best serve them. So it's not about waiting until there's an emergency. It's about doing things in advance of that to help avoid some of those emergencies down the road by intervening with the right type of care. One of the great ways to do that, just think about pharmacy as an example. Significant costs for self-insured employers. And when you look at medication therapy management and being able to look at ways in which individuals are getting their medications, oftentimes that's not organized. You might have medications that are interacting with one another in ways that are creating healthcare challenges. You can review that in advance now and do things to avoid those problems, and then help direct people to the right type of medications at the best cost. And while there are services that do that, not many are putting it into the perspective of a whole person care event, thinking about their whole picture and understanding what are their conditions and what are their goals, what are they trying to achieve, so that they're not necessarily taking something that might sideline them, but allow them to still live their lives to the fullest. And that's the goal with companies like Transcarent.
So I'm going to stay with that for a second. What role do you think the pharmacists will play in the future, right? Or retail drug chains, and especially in rural areas, as well as in conjunction with a Transcarent? Do you see a pharmacist as being an ability to have an eyes and ears for a company like Transcarent to help with patient care?
One of the strategic partnerships we entered into at Transcarent is with Walmart, and leveraging their pharmacy and presence, frankly, to see hundreds of millions of individuals that are going into Walmart stores every single month. And we're in a position to take advantage of being able to provide their best price, best quality promise every day to the consumers who are leveraging the Transcarent platform, and being able to use the medications that they're making available, whether they access it through the store where we can direct them to have a consultation with a pharmacist, or do that virtually and then have the medications delivered to them. And so part of the goal here is to make sure that we're taking advantage of some of the power of platforms in the marketplace, like a Walmart that provides, and other partners that we work with at Transcarent, to be able to deliver best quality care to Transcarent members.
Awesome. So Dr. Rhew, I want to ask you really quickly about data, right? We talked about data already, and we know that data is not the end all be all, but it actually is very important for you, right? From that standpoint, so you can personalize. How important is big data for you, especially coming in through, Microsoft Cloud for healthcare, and then applying it through machine learning, NLP, or artificial intelligence to give a better experience to your patients and to your clients?
If we think about like what are the factors for premature death and outcomes, it's obviously you've got information in the electronic health record, you've got information from the claims data sets, but we also know there's information on where you live, there's information that relates to your biometrics that we might be able to potentially capture through some of these devices. There's information about your genetics, your environment, all these different factors. So how do we pull all these disparate sources together and make sense out of all of that? Well, structuring that is certainly leveraging FHIR is a key interoperability standard. There's ways that we are now starting to pull all these different data sets together and make that more interoperable. But I think one of the really exciting and interesting areas that we haven't yet fully tapped into is all that data that's in unstructured formats, whether it be voice, text, perhaps even an image or a video. A lot of that is information that today is either sitting in a chart or somewhere somebody had written out. Even in a report within a DICOM image, you're going to have a lot of information there. You may have patients sending text messages or emails. There's conversations through CRM systems. All of that now can be converted from unstructured formats to structured, mapped to clinical terminologies, so that we can now combine these new data sets and understand in a more 360-degree view, what is that individual, where they're at, and what is their journey like. And I think that's one of the really exciting things about where we're at today, because we now have new technologies that allow us to be able to massage that data into formats that allow us to be able to make actions. Now, you mentioned big data. A big part of what we're trying to do is we're trying to pull data sets from different areas, but we also want to become very precise and specific. So when I look at patients, I want to know different types of patients, similar to that one that I'm dealing with. So as I get into these larger data sets, I want to be able to pull all that information and be able to make comparisons. When I do AI algorithms, I may build it on my existing data set, but I'm going to want to validate it on larger data sets just to make sure it's generalizable. So there's a big role for big data, but at the same time, we're going to drill down to the individual and try to make that very personal for them.
I think this is where part of our passions come from our company, but is about data and acquisition of data. And part of that is looking at, traditional remote patient monitoring maybe only good for certain subset of patients because of cost, right? From that perspective, to be able to get that data. But you also mentioned wearables, right, as well. And I think that wearable sensors, patches that are intelligent digital therapeutics to be able to acquire data and run it through algorithms, right, that are out there to try to nudge people into compliance or to get early indications of insights, how a patient's doing or building it into their therapy. How much do you think that wearables and sensors are going to play an important role to try to get to bigger populations of patients?
I think wearables are a really interesting story because I think we oftentimes think about the sensor as being the primary value proposition, where we're capturing this new biometric and we're now be able to somehow draw determinations. I think that will be a big part of it, but it's probably going to be done in combination with other factors, maybe other biometrics, information about the existing underlying condition. And then the AI can help us determine if an individual through I'll call it an index, is getting better or worse. So I think that certainly will be one element, but we're already seeing immediate value with wearables and other types of mobile technologies just through coaching and keeping people on task. I remember a project that I was privileged to be a part of, working with Kaiser Permanente to address an issue that they felt was something they couldn't do by simply, doing their current practice. And it was the fact that most of their patients who had a heart attack and were asked to undergo cardiac rehab were not completing this program. And so what we decided to do was talk to the cardiologist, learn more about the program. Turns out it could be digitized, put on a smartwatch. And then with that, they were able to then offer that as an alternative to what they traditionally do, which is 6 weeks of in-person, 3 times a week, 30 minutes. Most patients opted for the digital solution. Now, the caveat being is if they didn't wear it, they'd actually get a phone call. And there was an element here of patient compliance. But what we did see is that patients actually preferred those methods. The adoption rate or the completion rate for the program went from 40% to well over 80%. And interestingly enough, the readmission rates dropped from 12% to 1%. And I think what we're now recognizing is that part of the issue here is about make things easier for the patients and the consumers. On the clinical side, make it easier as well. So don't send all that data to the doctor because it can ultimately be managed through a program. And then demonstrate results, show that this is actually saving time, improving adherence, improving patient satisfaction, and then reducing costs and ultimately leading to better value. So I think there's huge value in these different devices, but we may need to think about how we use them in a slightly different way.
It's a great point, David. And in terms of thinking about the use and the use case, my cardiologist may not want to necessarily know what's happening with my heart rate all the time from my Apple Watch. Likewise, at Livongo, when we were pulling data from individuals who were testing their blood sugar, whether it was coming from a continuous glucose monitor or from periodic checks during the course of the day, they didn't necessarily want to see every reading. And so the power in the analytics is to look and see what's normal for you. So if it's for Kent, what's his range, and keeping time in range, that's going to be, I'd much rather have that guest speaker join us, David. That would be great.
Yeah, there you go.
But the opportunity to have information about what's normal for us at any given point in time is really important to understand. And so my engine will run very differently than Kent's engine. And so having a sense of where my blood sugar should be may not necessarily be the same as a 90-day average that's used for population health metrics. What's healthy for me will be important. And I think that getting to that point in terms of utilizing these tools appropriately and sharing the right information at the right time with the consumer to nudge them towards health, or to the provider to allow them to make clinical decisions, like let's say a medication that needs to be titrated differently, that's going to be a real important element of how these systems get used and progress. One last comment to note, because it's an important element of where we sit in the market today. We're involved with a company, BioIntelliSense, that's doing a fantastic job with regard to providing a patch that's worn by consumers, but it's also being worn by patients. And for those of you who've had an experience of being in a hospital, getting woken up in the middle of the night to have your vitals taken is not great. And it's probably the worst place you can possibly sleep and recover. But imagine now that you put this patch on, all the vitals are going to the cloud, and your conditions being evaluated by algorithms so that the nurses now are coming in to work on an exception basis, and they leave the patients who are normal and stable alone. And that's a huge advantage in terms of being able to address the critical nursing shortage that we have in our healthcare facilities today. So we're excited about use of technology applied in the right way, but you wouldn't necessarily want to see all of our biometrics streaming on the screen at any given point in time.
Yeah, I'd like to say God bless to you, like Lee. Those are words from my lips, right? I love what you're saying, right? And we always call it life in context. So people, measuring people against themselves, right? From that to be able to do. One of the things I wanted to talk about really quickly, Lee, is we talked about use of technology. We talked about data from that perspective. What is coming on the marketplace right now, or exciting things that are coming on the marketplace right now that you think can actually help propel Transcarent forward, or the industry forward in its use of value-based care, or cost containment or quality measures?
Well, we're certainly facing some challenging economic times, and we know that the trend for healthcare spend has continued to rise even faster than the rate of inflation, and so we need to find ways to be able to take our healthcare resources and to do a better job. We spend more in the U.S. on healthcare. It's a pretty well-known fact than most other industrialized countries, and yet our outcomes are not great. I mean, think about the maternal mortality rate in childbirth that we have here in the U.S. that's worse than other countries by a significant multiple. And David probably can talk about it better from a population health standpoint. So what excites me is about the ability to use these tools in a way that allow us to better moderate the spend and be able to provide care at better prices for individuals by meeting where they are. And we call this notion shift left. Rather than getting people into ever higher kind of the shift right, higher location, price location, let's say it's an emergency department, a hospital, higher modalities for treatment, can we meet them where they are at home and deliver care, especially primary care for individuals who have chronic conditions, and to manage that in ways that allow us to avoid some of the high cost exacerbations that might occur if it's not properly managed. And this goes back to well care versus sick care. Let's keep people healthy, and let's use some of these types of technologies that Life 365 and others are providing to do that in ways that allow us to better manage our costs and spend on the things that are really important.
Thank you. One of the questions I really have, and Dr. Rhew, I'm going to come back to you. We're seeing the emergence years ago of the telehealth companies like MD Live and Amwell and Teladoc and others that are out there. In fact, Livongo got acquired by Teladoc from that. What are these companies going to emerge into? And there's telehealth companies out there that are doing episodic care. They're naturally going to be going into virtual care and to chronic care management. Where do you think they're going to evolve? What's their place going to be in the marketplace?
David, you want to jump in first?
There.
Well, I think first off, there is definitely a gradual and now accelerated transition towards digital and looking at ways that we can improve the adoption. It's extending our capabilities is what it's allowing us. It's allowing us to be able to have another touch point with a patient. If we add remote patient monitoring on top of that, you've added more touch points. The more touch points that we have with individuals, the more that we are likely to stay on top of it if their condition is getting better, worse, or the same. And that then dictates how we should be able to apply resources. So I think the future of virtual care is really about continuing down that path, but making sure that it's not just about replacing an in-person visit. If that's all it is, which is where we're at today, and simply capturing the data, we need to start thinking about how we apply AI, ML, become much more smart and efficient in terms of our resources, understanding when patients need earlier intervention versus later intervention. And that's the next challenge, the next chapter for virtual care. It's also about leveraging some of the newer technologies that we have in terms of helping support individuals as they are working in different areas. Give you an example. When we started during the pandemic, recognizing that a lot of clinicians were not able to go into COVID units because of the fact that it's basically exposing everyone to the virus, and there's a lot of PPE. Researchers, or I should say clinicians at the National Health Services, NHS, they started creatively using the HoloLens as a vehicle. And what they started doing there was now the individual would walk in and they had an entire team behind them, a virtual team. And so now we're starting to think about virtual rounds. And so virtual care isn't just about patients, but now it's about how do you collaborate within organizations to become much more efficient. We've then seen it extend to nursing homes. Now you've got a nurse that has a HoloLens. When she pops it on, she's able to now have individual bedside rounds on all the patients, and you've got the clinician able to see that. So I think we're starting to see really an emergence of a variety of different things being incorporated, artificial intelligence, newer technologies, and different use cases.
The toothpaste is out of the tube when it comes to telehealth. And I don't see that there's going to be a retrenchment back to the way we were before. Consumers love it. All the surveys indicate that they like having access to providers when they have the need. And in some cases, it's really important because there's limited access, especially in some of our underserved communities and rural communities. And so there's a limit, though, to what Dr. Rhew could diagnose, Kent, about you and I just using video. And so using tools that allow us to capture your body's vital narrative that comes from the biometric information that we can get. So when whether it's wearing a connected blood pressure cuff or a scale, or using tools like glucometers, wearing a patch that's doing things to capture other information like heart rate variability, those are all things that are going to add more color, more insight. I think it puts the health into telehealth, being able to share that type of information with a provider at the other end. And we also can't lose sight of the fact that access is really a challenge for many Americans. We're working on a project at the American Heart Association called Doctors with Heart that's allowing cardiologists to communicate with primary care providers in rural communities where they don't have access to specialists. Companies like Homeward that just launched earlier this year that are helping to bring specialist access using telehealth into rural communities where it's desperately needed. So I think there is an important role to play for telehealth as we go forward, but also it has to be paired with the types of tools that allow us to capture better information about an individual than just assessing whether or not an in-person visit's needed. Really, there are things we can be doing from a diagnostic standpoint, from an in-home testing standpoint as well, that will allow us to capture more information to add fidelity to those encounters.
Yeah, it's interesting. My clinician, PCP, basically said he's not taking insurance anymore, right? He's going to be doing more concierge. And he said, how can I change my practice? And I said, one of the first things is if I'm coming in for a 6-month visit, I don't need to come into the office. I should be able to do it behind, the screens that are here. We live in Arizona. We can have Snoring Quest come out and take a blood draw a week before, right? To do that, I've got, vital sign equipment, maybe more than most people, right? That I can give them spot vital signs that we want to. And we can spend our visit doing more of a back and forth visit instead of trying to get all the boxes checked, right? And the EHR filled out. On my specialist, I'm not going to change away from my specialist. I'm probably still going to go see my specialist from that. But on my PCP, I'm okay with a virtual visit with my PCP, whether it's my normal doctor or whether, it's a doctor that I'm just going to offhand, right? For maybe I have a sore throat or an infection, right? From that. So I'm okay with doing those kind of things. And I think people are getting more and more comfortable with that as well. The conversation that we're having locally here is once, the testing companies, you talked about testing, the testing companies now are going and taking a blood draw or phlebotomist to the home. What other things can they provide being the eyes and ears in the home? Can they do a fall assessment? Can they do a vision test? Can they do, a blood draw, right, that's out there? Can they be the eyes and ears for the virtual care docs? Because they're not seeing the person in person. So I think there's a big industry that's going to grow around. We already have home health care that's going to go around being the eyes and ears for virtual care with patients as they enter the home.
We've made an investment in a company called MedArrive that's doing just that.
Yep.
They're leveraging the resources of emergency medical technicians going into the home and providing resources that now you can also have that EMT in the home connecting to telehealth at the same time. But as you mentioned, blood draws, vaccines, wound care, home assessments, and the like, all can be done in terms of providing some service in the home. But there are also things that can be done on a self-guided basis where you don't need an individual to do that. We're supporting caregivers with another one of our portfolio companies called Home Thrive that's guiding caregivers on how to do this with regard to their loved ones, their seniors and individuals with special needs. And so I think that technology can provide a basis to help us do things we need to do. One other quick thing that we didn't mention, Kent, recognizing the time, but the use of telehealth for mental health services has exploded. We've seen a massive amount of investment in the space. It was the top sector for investment last year and early this year. And that's because of the convenience and improving access for individuals without necessarily some of the challenges and stigma that are associated with going into an office to do that. Giving people convenience and the ability to do that from home has also made a huge difference in many people's lives.
Yeah, I think the pandemic actually accelerated a lot of that, right? From that perspective. So that's what I was going to ask you. We're going to wrap up here in a few minutes, but Dr. Rhew, going forward, what do you think is the next level of technology or solutions that you're excited about that can actually help the health systems, right, that are out there and patients and consumers in their home?
Yeah, I think one of the areas that I think is probably the time for us to start thinking about how we transform healthcare relates to the ability for us to apply natural language processing to all these different unstructured formats. And I'm going to start with voice. Just simply the conversation that you have with a clinician, being able to convert that from voice to text, understand the concepts, map it into the clinical terminologies, organize it into a progress note, and push it into the electronic health record after a quick review. That actually saves clinicians 75% of the time required to enter documentation to EHRs. And so as these tools get deployed, that we're going to find a dramatic impact. It's going to free up the time for clinicians to spend time with patients. It's going to allow us to be able to extend that care, have so that the patient is actually talking to your face, not to your back. I mean, there's going to be so many added benefits of having these technologies. Now imagine applying this same type of technology with the text on all the things that you're getting, whether they be inbox, emails, text messages, other things, all being converted, organized, potentially removing that individual has to type things from faxes into actual forms. We can streamline healthcare so much better and allow people to practice at the top of their license. I think we've asked our clinicians and a lot of the folks to be able to do a lot of these things that there was not a process before. So it required a human to do that. We're going to start changing that paradigm and making healthcare much more efficient.
From your time at Samsung to now over at Microsoft, and over the last 10 or 15 years, have you seen consumer adoption improve towards digital health and towards moving care to home?
Well, absolutely. We've definitely seen, and certainly during the pandemic, but there is one group that I think I want to make sure that we pay close attention to. It's the folks that are least likely to use digital, whether they be in areas that don't have affordable broadband access, or perhaps they don't speak the language and it doesn't communicate well with them, or perhaps they've never been introduced to the health system. These underserved populations, the individuals for whom are vulnerable, those are ones that we need to start thinking about. How can we do more? What can we do as a country and as partners in this community to be able to provide these type of services to these folks? And I think that's where a big opportunity for us to be able to democratize the technologies that we have so that everyone can take advantage of it. And in some cases, rely on other individuals to use the technologies to support those that can't. And so I think we're going to start seeing a shift in terms of how we think of technologies, not just for the consumer tech savvy individuals, patients, but really for everybody.
Yeah, I fully agree. Fully agree, David. And we've seen that sometimes our rules and regulations need to catch up with the times. Broadband may not be accessible, but there is a wide penetration of smartphone availability in underserved populations. 85% of individuals that are in Medicaid populations are reported to have a smartphone. But oftentimes we restrict the use of text messaging to reach those people. And so we have to change some of the rules to allow us to be able to do the things that we need to do to get a hold of them. And we've seen during this public health emergency, when some of those rules were relaxed, that we were able to, a company that we work with called Same Sky Health, that is creating culturally appropriate messaging to different populations to get them engaged in things like getting COVID vaccines and coming in for healthcare visits, because it's safe to do so now in spite of the fact that offices were closed earlier in the pandemic. And I think that if we can meet people where they are, that we'll be able to use some of the tools that they already have in order to give them better access to healthcare.
Yeah, the interesting thing, we got to wrap up here in a second. I've got another question for you really quickly, Lee. But I'm really excited about the rural areas, especially here in Arizona, mainly tribal areas and outer areas that are out there. Being able to use Starlink and Swarm, right? I mean, they're going out very, very quickly now. When I looked at the map for Starlink, it covers almost all of Arizona now, right? From that standpoint. And we've done projects before where not only we put the devices in the home and spoke Spanish, but we also spoke Navajo, right, as well. And we found out that it was much more adopted, right, from that standpoint, like you talked about, Lee, culturally, right, being the speaking in their own language, they're much more to use the technology, and they're much more to stay compliant, right, as well. The question we had really quickly come up was Transcarent's revenue model, right, from that. And I know I don't want to throw that at the very end, but just very quickly.
Yeah, I just typed an answer to the
Okay.
Q&A, but Transcarent only makes money when it saves money for its clients. And so they take on full risk with their clients, and when they generate savings from providing better access to care and helping to reduce the overall cost of care, they share in some of the savings that are received by their partners.
That's great. Well, thank you. So I want to thank everybody for attending this afternoon. I especially want to thank Dr. Rhew and Lee Shapiro for participation in your great insights. We'll post the recording on www.newnormal.buzz later this evening. Stay tuned for new episodes. You can find registration details on newnormal.buzz. We'll be skipping next week for Memorial Day, and we'll resume on Wednesday, June 1st. We'll be talking about big data, and we'll also be having guests in from Amazon Lab 126 as well. So we look forward to you joining us on the future episodes, and have a wonderful evening. Thanks, Lee.
Thanks,
Dr.
Ken.
Rhew.
David, great to see you.
Right. Bye-bye.